Hi, Dr. Joseph here. I am often asked by the mothers in my office what are things they can do to help present the illnesses that I treat, such as autism, allergies, asthma, ADHD, constipation, diarrhea, etc. And the two things I focus on the most is number one, making sure mothers are the healthiest they can be, particularly during and around pregnancy. Number two, the other thing I focus on is we do have a lot of very good research that shows children who are born within a 24-month window between each other do have an increase, particularly of autism, by about threefold. So, and that has to do with number one, in reality, which we do know that that the mothers deplete their stores of nutrients after a pregnancy. Three key nutrients that are depleted are iron, folate, and omega-3 fatty acids. This particularly occurs during the third trimester when mother basically gives all of the nutrients to this developing child. And then afterwards, it can be even further depleted as a mother is breastfeeding. And so I very often, during my well child visits, talk to mom after I've examined my brand new little babies, said, Mom, okay, how's your health? How are you doing? We need to focus on you now. We need to get you back. We need to get your health and your nutrient reserves up. And so those are things that I stress very highly among my patients. There are some dietary recommendations and some good healthy eating recipes that I posted online, but we can only really get a lot of nutrients replenished so far with health and nutrition, because our food in our environment today is just not quite as healthy as we'd like it to be. So I do recommend some supplementation. I'm going to talk about three that I really like. Number one is OptiNatals. It's by a company called Eclectic. It's an organic company, and it has the nutrients that I wanted. That I've clearly seen research shows it prevents a lot of illnesses. Number one, it has the 800 micrograms of folate that are recommended. Reduces the risk of spina bifida, as well as now we know in autism. Has 1,000 milligrams of vitamin C. This has been shown to reduce allergies and asthma. It's also been shown to help improve the immune system in developing fetuses as they progress along. And mothers have a higher levels of immunoglobulins in their breast milk with it. It also has iron. It has 50 milligrams of a chelate iron, which is a non-constipating iron. That's the biggest complaint I get from prenatals that makes them constipated. This one does not. Has a couple other herbs in it, rutin, hesperidin. These are bioflavonoids that help strengthen capillaries, blood flow, as well as their uterine tonics, making these in old midwives and research has shown that it helps with the uterus and keeping it strong and healthy. The second one I like is called Vital Nutrients. It's ultra pure fish oil. This is a omega-3 oil. It's very pure. It's guaranteed to be pure, have no impurities of pesticides or heavy metals. Please, if you're on a fish oil, make sure your company can guarantee that. You want roughly about 1,000 milligrams of omega-3 oil. Make sure when you look on the back it says omega-3s. Oftentimes they'll say 1,000 milligrams of fish oil, but that's not necessarily an omega-3 like EPA, or sometimes it has DHA in there as well. This does not taste like fish or smell like fish. If a product does, it's bad. Don't go for it. It's got proteins in it. The third one I recommend is Maximum GI Health. This is a probiotic. It's one actually I developed. I have a microbiology degree. It's got 11 strains of probiotics, all shown to reduce the incidence of allergies and improve the immune system by helping it develop appropriately. So the incidence that it reduces is about 20 to 40% of allergies and asthma. I mean, it's huge. European studies are huge on probiotics. It also has been shown to help with GI discomfort, nausea, and constipation, which we know can sometimes happen in pregnancy. Most important, though, it does help prevent Group B strep, which is a test and something they check for at the end of your pregnancy. And if you do have it, they recommend giving antibiotics. It can cause a severe fatal disease with your infant, and this helps prevent it. So these are my three favorite products. Again, if you choose not to use these, here's the dosages I want you to get. Folate, I want 800 micrograms. Vitamin C, I want 1,000 micrograms daily. Don't go any more. Calcium, another 1,000 micrograms. Iron, you want between 30 and 50 milligrams. Omega-3 oils, you want about 1,000 milligrams a day. And get a good quality probiotic that has at least 5 billion colony-forming units. Mine has 25 billion, so it's guaranteed to be alive. And have at least multiple strains, at least 5 different strains. If you have any questions concerning other products or anything about pregnancy, please feel free to email me. There's a lot of information on AskDrJoseph.com as well. Thank you.